as usual, I'll be talking about dry eye, and these are my, interests. The first thing that I want to tell you is that dry eye is not a problem of tears. It's a problem of the ocular surface. It's a problem of the ocular surface system. And the ocular surface system is continuously balancing. And when something happens, you lose the ability to cope with the external stimuli. And we have seen a change in the definition of dry eye. And this new definition reports the fact that the break and homeostasis. And this will start a chain of events that brings to the fact that the ocular surface cannot be kept in balance. I mean, the ocular surface is the tear film, the epithelia of the limbus, of the cornea, of the conjunctiva, the lids, the lashes, the nasal puncta, and the lacrimal glands. They all work together to equilibrate, to make a response, or eventually something is coming to our eyes. So, and they react all time, and very quickly. And so if something gets wrong, because the stimuli are too strong, the stimuli and they break something, and this ocular surface is not able to adapt, and it starts a kind of vicious cycle, a self-maintaining vicious cycle. And then the stimuli can disappear, but this vicious cycle is maintained. And so that is the disease. And whenever you have a long-term disease on the surface, you always have, starting from pinguecular to Stevens-Johnson's disease, you always have on the ocular surface instability of the tear film, apparent or non-apparent inflammation, and some changes in the function or the survival of the epithelium. These three things can be caused or may cause changes in the lid margin and in the nerve structural and functional activities. So this is the ocular surface disease. There's no sense saying you have a dry eye, but in your dry eye, how much the tear film is compromised, how much the inflammation is present, and how much the epithelial is suffering. This is the diagnosis. I'm not interested in putting a target. I want to see it. And my treatment will be in covering all the single point of this chain. And as we see, something happened to the unhealthy ocular surface, and then because of hyperevaporation, reduced clearance of the tears, you get changes there maybe in the nerve function, or you change in the osmolarity, and you get irritation. This is one patient. You keep the irritation and say, just put a drop whenever you want, and you get inflamed. And this is, inflammation. It's a different patient. And if for any case, this patient has some troubles in the immune system, or the inflammation goes on for time to time, and then you have risk factors for that, and you get immune-mediated inflammation, another different patient. So it's chronicity what's bringing us the disease. And you see here the dry eye is very frequent, and we believe it's around 25% of the population, depends on how you measure the presence of dry eye. But when we think a patient with dry eye, we see a young 50-year-old lady, and this is not true. That was several years ago, a few years ago, but now we're facing a younger generation of dry eye patients, which I call multi-screen dry eyes. And the multi-screen dry eyes are patients that they have dry eye because the stimuli, the external stimuli to the surface are so prolonged during the day that they, the average person, that means you and me, is staying 8 hours in front of the computer, which is crazy. I understand, but it's so. And that will be growing. So this has an effect on the quality of life. Pain, which is pain all days, every day, all day. I mean, that's important. It's misrecognized by the ophthalmologist, but the patient knows very well. they decrease in visual performance, contrast sensitivity goes down. The perception of the patient is, is changing. There's something is not going very well on my eyes. And they see it's day after day after day, so they get worried. They feel something wrong with their body and their ability to cope with the things. So it's increases is the awareness of having a disease. And this is a very interesting study, which because you is just asking to the patient, how many years of your life will you give away not to have the disease? And they made it for a long list of diseases. And what came out, that you have a mild dry eye, you have the same score of mild angina. And if you have a severe dry eye, you have the same score of severe angina. That's a very different perception of the patient with dry eye we have as an ophthalmologist. But the patient is thinking to have a very serious disease. And can impact, of course, when you have some troubles and you cannot read properly, you're not quick in getting, your answer, and this it will affect your, activity. And there is something that is called presenteeism. People going to work and not doing their work. I'm sure you know a lot of people doing like that, but especially dry eye patients, they have this. And this is going to cost a lot for the society. So its social cost is higher. And of course, the contact lens problem, contact lenses now are made very well as a function, oxygen and permeability and design, but the problem with the contact lens is that if you don't have enough water on the surface, a perfect working ocular surface, then you can tolerate it longer. So it's a problem. Dryness is a problem for contact lens. If we look at the symptoms, there are some kind of factors that can be predictive of a high symptomatology. We know, as having chronic pain, being prone to ocular surface hyperreaction, like atopic patients or allergic, or sometimes using drugs and depression or antidepressant or something. So they are more reacting, they have more symptoms. But what is strange to us, it makes the diagnosis difficult and makes it difficult to us to understand the patient, is the fact that there is such a discrepancy between signs and symptoms in many of the patients with dry eye. So just following the signs is not enough, just following the symptoms is not enough. But we have to mix them. And of course, surgery has an impact on dry eye, but also dry eye has an impact on the quality of surgery. For instance, if we measure a multifocal intraocular lens in a patient of dry eye, it has been demonstrated that there is higher risk of wrong measurement of that. And vice versa, the patient who had cataract surgery and had a borderline dry eye before surgery and then goes to surgery and gets a dry eye will say, well, something went wrong with my operation. And that surgeon did something wrong to me. And it's not really just the fact that the drugs you put in the eye after the surgery, the anesthetic you put during the surgery, will unbalance the system of the ocular surface. So the patient shifts into the vicious cycle. So it's important that we recognize and possibly treat the dry eye before getting them to surgery. And we notice that after LASIK treatment, you have some recurrence, and these recurrences are more frequent in patients who has a dry eye. And so we already said about phacoemulsification, the fact that a number that's been calculated around 20% of the patients who do cataract surgery do have some problems related or symptomatic like a dry eye. So it's an important issue for our quality. We have a high quality of surgery, and then we have to face the problem that the patient is not satisfied they should be. And lastly, I want to say dry eye can get worse during the period of the disease, and this is important to know. You have to stop the evolution of dry eye by controlling the main factors, which are, as we said, instability, inflammation, epithelial malfunction. So in this study, it has been nicely shown that around 25–30% of patients get a worsening of their quality of life. So in conclusion, we have the prevalence is not clear. It depends largely on the way you measure it. But we are going to face this multi-screen dry eye patients and patients with increasing contact lens intolerance. And this patient with the contact lens intolerance will go to have surgery, LASIK or SMILE surgery. And if they don't have a perfect ocular surface, the ability to react, their surgeries will not be so satisfying. And so please think dry eye to the patient you see, because you are going to see more of them. Thank you for your attention.